1 centimeter kidney stone, 1 cm kidney stone, ano nga bang options mo for treatment kung meron ka nito or kung meron kang kilalang ganito? Malalaman mong meron kang kidney stones through symptoms, and you can confirm it with ultrasonography. Minsan, um, incidental finding lang, CT scan or MRI. Most of our patients, nalalaman nila yung kanilang status kung may kidney stone sila through ultrasound or CT scan. Rarely do we receive patients, stone patients, na CT scan yung dala nilang gamit. No, result. Okay? So, let's keep it simple. Diretso natin sagot. Kapag meron kang 1 cm kidney stone or anywhere near this size, ano nga ba ang options mo for treatment? Let's start with the least invasive option or simplest option of them all. Kapag meron kang 1 centimeter kidney stone. First option is medical dissolution. Ito yung, actually, this is one of the most attractive options for patients who have kidney stones, which is medical. Gamutan lang muna. And we always offer this to our patients, especially kung medyo maliit-liit yung kidney stones nila, tulad nitong sinasabi kong 1 centimeter kidney stone. Kasi can you imagine gaano kaliit ang 1 centimeter na kidney stone? Maliit lang yun. Tingnan niyo yung ruler kung gaano kaliit ang kidney stone na 1 cm. Tingnan niyo kung gaano siya kaliit. Pero, lagi kong sinasabi sa mga patients ko na ang 1 centimeter, it's small sa totoong buhay. Pero relative to the size of the kidney, relative to the size of the calyces, yung loob ng kidney mismo, meron kasi siyang potential na magbara sa loob and cause problems. Okay? So, medical dissolution, bagay ito sa mga pasyenteng yan. May maliit na kidney stone, 1 centimeter. Maganda siya for uric acid stones because uric acid stones are known to be treated with medical dissolution by alkalinizing the urine. Ang explanation doon is that ang uric acid stones, they form in acidic urine. So, binibigyan kayo ng medications para i-alkalinize, gawing mas basic instead of acidic yung inyong urine para ma-dissolve or matunaw ang kidney stone. Okay? Also, nababagay din ang medical dissolution treatment for patients with a small kidney stone such as a 1 centimeter kidney stone kapag may tiyaga yung pasyente. Kasi, although madaling sabihin na gamutan na lang, attractive option siya for most patients kasi hindi operasyon, di ba? Attractive talaga yun. Ang problema dyan, kailangan matyaga ka. Kasi drinking medications, taking medications also takes work, awareness. You have to take the medication for a prolonged period, weeks to months on end, until ma-dissolve yung bato, hanggang matunaw yung bato. So, kailangan matyaga ka. For example, yung gamot, isa sa mga gamot na binibigay to alkalinize the urine is potassium citrate. You will take, depende sa magkakaibang dosing to pero usual dose is that you take 6 tablets of it a day for weeks to months on end, and then you have to monitor your pH ng kidney mo, ng urine mo, para malaman mo kung nagiging alkaline nga yung ihi at nalalaman mong gumagana yung gamot. So, paano mo i-monitor yun? Bibili ka nung urine dipstick exam, and then you will pass a urine, you will take your own urine, ilalagay mo sa isang lalagyan, sterile na lalagyan, and then ididip mo yung dipstick. Then you will check yung pH level para malaman mo kung nag-underdose ka or overdose nung alkalinizing agent. 'Di ba? So, madaling sabihin na inom-inom lang ng gamot, pero it also takes work. It also takes your time to take these medications, and you have to remind yourself na to take them always, and you have to maintain certain level of pH para lang ma-alkalinize yung urine at ma-dissolve yung stone. Okay? So, pinag-uusapan natin sa mga bagong pasok lang is for 1 centimeter kidney stones. I'm just taking this as an example. Closer to this, ano bang options mo? Ito, meron ng relevant question agad na pumasok kay Emerlyn. Doc, how about yung 0.45 cm lang na stone? So, it's a smaller stone. It's a sub-centimeter stone. Mas maliit sa 1 centimeter. Then, it's a good candidate too for medical dissolution. Pero again, medical dissolution, may binabagayan na pasyente, may binabagayan na bato. Okay? So, mas pabor yan kung uric acid stone. Other medications say na they can also dissolve yung calcium oxalate stones but less likely to get dissolved. So, depende yan. Depende rin ang medical dissolution kung gagana siya. Kung depende yan sa pasyente, kung masipag kang mag-take ng gamot. Depende dun sa metabolism ng pasyente. Kung grabe rin yung stone forming capabilities ng patient. Baka mahirap i-control yung formation at yung progression ng stone. Okay? So, medyo bagay-bagay dun for patients. Okay. Ito, another relevant question. Ano pong symptoms ng may kidney stones? Okay. Ito, just to answer this in general, depende kasi rin yan sa size ng stone, location ng stone, if it's causing obstruction, minsan, napakasakit ng stone na nagbabara. Or minsan, wala talagang simptomas yung pasyente na merong kidney stones. So, it's a wide range of symptoms for patients with kidney stones. Okay? Again, pinag-usapan natin yung kung meron kang 1 centimeter kidney stone or any size near this measurement na 1 centimeter, what are your options? I said, medical dissolution. Next na option for these patients is shockwave therapy. We call this shockwave. Ito yung vernacular niya. Pero the formal name is extracorporeal shockwave therapy. Extracorporeal, outside the body. Merong shockwaves na pinapadala paloob ng katawan, targeting the stones para madurog silang ganyan. So, ito the shockwaves are invisible. Pero ito lang, just to illustrate, tatamaan niya yung stones, then, mababasag siya small enough para maihi mo siya palabas. Okay, siguro dito sa illustration na to, by experience, siguro itong malaking tong nasa gitna. Sige, yan. Nasa 2 to 3 centimeters yan. Siguro yung 1 cm stone is this one. So, di ba? Ang liit niyan. Pero potentially, it can still cause problems. Okay? Mahirap talaga masabi na hindi mo mako-correlate lang yung size na mas malaking stone, mas malaking problema. Okay? So, ito yung 1 cm stone. The other option is shockwave therapy. So, ang ibig sabihin yan, for stones na may stones na dito na tinatalaban ang shockwave therapy. Meron ding stones na resistant to shockwave tulad ng cystine stones, calcium oxalate dihydrate stones. Mas mahirap silang matrix stones. Mas mahirap silang mabasag ng shockwave therapy. Okay? So may binabagayan din. 'Di ba? So hindi lang 'yan na basta maliit yung stone size mo, 1 centimeter stone, pwede na yung shockwave. Merong pa ring binabagayan ng shockwave therapy. And also, pag shockwave ka, it's not instant. Kailangan nyo maintindihan na pag shockwave kayo, kailangan mo nang madurog yung bato at kailangan mo pa siyang ilabas naturally. Some patients, kapag nadurog na yung bato, nahuhuli nila, napapansin kasi pinapasala yung ihi pagkatapos mo ma-shockwave nahuhuli nila yung mga stones nila, tapos napapadala for stone analysis. Minsan naman, Yung shockwave, yung stones naman, na ito, sobrang pino na niya, hindi mo na mapapansin na lalabas sa katawan. So, magkakaiba rin ang presentations. At yung isa sa mga nagiging problematic naman ng shockwave kapag yung mga stones na yan, 'di ba, nadurog nga, pero nagkumpul-kumpul naman sila sa ureter at nagbara, problema rin yun. Anong ginagawa doon? Ang tawag doon pala Stein's stress. Ang ginagawa doon, shockwave ulit, ureteroscopy or PCNL. Okay? Next option, again, sa mga bagong pasok, ang pinag-usapan natin, paano kung meron kang 1 cm kidney stone, nakita mo sa ultrasound mo or sa CT scan mo. Result, ano ba yung mga options mo? First option is medical dissolution. This option, shockwave, na discuss natin. Okay? Next option is retrograde intrarenal surgery, or as we call it, RIRS. Medyo nakabulol. RIRS. Okay? Basically, gumagamit kami ng flexible ureteroscope. This is the instrument na ginagamit. It's a flexible scope na ginagamit. Pinapasok siya sa daluyan ng ihi. Male or female, mahabang-mahaba yan. Umaakyat galing doon sa daluyan ng ihi, sa butas ng ihian, papasok dito sa ureteral orifice. Nakikita niyo yan? May maliit na butas. Ito yung kabila. Oh. Di ba may butas? Pinapasok doon. All the way up sa ureter hanggang maabot mo yung kidney stone. Pag naabot mo na yung kidney stone, anong ginagamit namin para basagin yung stone? Lasers. Lasers lang yung uubra sa retrograde intrarenal surgery. So, kailangan yung gagawang surgeon sa inyo ay nasa institution na merong laser. Dapat available yung laser. Available din yung expertise na gumagawa ng retrograde intrarenal surgery. Most urologists naman, nasa armament na namin yung ganitong klaseng surgery. So, advancements are already here in the Philippines. So, I'm very proud to say that na itong mga techniques na to are already available here sa Pilipinas. Hindi lang to pangarap na. So, ibang bansa, ganito. Kaya natin yan dito. Okay? So, once maabot, dudurugin siya ng laser. Tapos, meron din kami mga maliliit na instruments called stone baskets para i-grasp yung mga stones, tapos ilalabas mo siya all the way out. Okay? When dusted naman, ibig sabihin, parang dinurog mo ng very, very fine yung bato, para lang rin siyang shockwave na ihihi mo na lang. Hindi mo na mapapansin. Okay? Ito pala. May illustration naman pala. This is a stone basket. Nakita mo? Kumbaga, ang illustration na to, dinurog niya yung stone, tapos, pinulot niya ng basket. Okay. Maingat na inilalabas all the way out of the body. Credits dun sa kinunan ko ng picture nito, Pace Hospitals. I think this is in Hyderabad sa India. Okay? Galing, diba? So, that's one option that you can do. Again, may binabagayan lang rin yung mga stones na ganito. Okay? Kasi, again, ang pinag-uusapan natin are 1 cm kidney stones. Smaller stones. Relatively smaller stones. Okay? So, ano na sasabi ko? Relatively smaller stones. Kasi, kung masyado namang malaki yung stone, for example, ito mismong buong kidney. Yan Yan, buong kidney na yan. Paano kung punong-puno yan ng stone? Sure, kaya pa rin abutin nung retrograde intrarenal surgery. Kayang-kaya pa rin abutin. Tapos, kaya mo pa rin magdurog. But, it will take a longer amount of time to perform the surgery. Kung yung malaking stone ay dudurugin mo ng laser using RIRS, you should have a very good type of laser na works all the time, hindi pumapalya, at nadudurog ng maigi ang stone. Okay? Kasi, actually, I want to emphasize na yung ganitong surgery, ibang part yung pagpasok, parang ibang challenge yung pagpasok, maabot yung kidney stone, yung kidney at yung kidney stone. Ibang challenge din yung pagdudurog ng kidney stone. Kasi it will take time, it will take expertise, tapos it will take you a lot of fluids para lang matapos yung surgery. So there's a risk of sepsis, there's a risk of, sabi merong we call this gusto ko sabihin yung tamang term, tataas yung temperature sa loob ng kidney. So kinokontrol namin yung lakas ng laser lang. Okay? So the longer the time ng surgery, so mayroon ding risk ka na magkaroon ng sepsis. Sepsis is severe infection, lalo na kung yung mismong stone ay infectious stone. Minsan dormant lang yung stone yan, pero pag nabasag siya, nagbabato ka ng bacteria all around the kidney na which can get absorbed by the bloodstream then. Okay? So again, may binabagayan yung ganitong type of surgery. Pero I also want to say na in other countries na like Australia and not India, Australia ko lang narinig na they're already challenging the norm na kaya na rin daw gawin yung malalaking stones using RIRS, and those are in super specialized centers na advanced centers who are challenging the norm kasi syempre safety pa rin ng patient ang primary concern natin dyan. So until it becomes the norm na mapatunayan by studies na pwede mo na siyang gawin, then we will follow suit. For now, we will reserve yung RIRS surgeries. We'll also push the boundaries sometimes, pero dun as safe as possible lagi ang prinsipyo sa pag-oopera ng kidney stone. Okay, again, sa mga bagong pasok, ang pinag-uusapan natin dito ngayon ay yung mga malilit na stone. So, for example, may nakita po kayo na 1 cm kidney stone sa inyong ultrasound or CT scan. Ano ba yung options ninyo for treatment? Again, just to summarize, medical dissolution, gamutan lang, shockwave therapy, and RIRS surgery. Okay? Before we proceed to the last option na ginagawa, sagutan tayo ng relevant questions here. Sabi ni She Sandel, confinement po ba ang kailangan kapag nag-RIRS? This one, retrograde intrarenal surgery. The proper answer to this is retrograde intrarenal surgery can be done on an outpatient basis, pero laging depende yan sa pasyente. Hindi sa desisyon ng pasyente, depende yan sa kondisyon nung pasyente kung mukhang matotolerate niya yung outpatient na surgery. Sometimes patients have different comorbidities na kailangan i-control muna, na kailangan mo nang i-refer sa iba't ibang services bago mag-proceed sa surgery. So sometimes you'll need to be confined before and after the surgery. And also, depende rin kung magkaka-encounter kayo ng komplikasyon. Kung perfect ang surgery, walang naging problema sa buong operasyon, then pwede yan outpatient basis. Pero sometimes, post-operatively, nagkakaroon ng fever yung patient, nagkakaroon ng infection, sepsis, then kailangan ma-confine yung pasyente. May binabagayan again. Walang iisang sagot dito sa tanong na to. Pero, just to give you a good idea on how we treat kidney stones and give you a good idea on how we perform RIRS. Yes, we can perform this on an outpatient basis. Outpatient, ibig sabihin, pupunta kayo sa ospital ng umaga, gagawin yung RIRS sa inyo, pagkatapos yung maoperahan, magpapahinga kayo ng konti sa recovery room, then makauwi kayo. Yun yung outpatient basis. Pwede siya sa piling mga pasyente. Okay? Good question, Shep. Good question. Ito, meron siyang tanong. 1.7 cm stone. Pwede po ba i-shockwave? Again, ito yan may binabagayan ng shockwave. Kidney stones na 1.7 centimeters? Yes, pwede pa rin naman. Okay? Pero yan, hindi lang basta size ang pinag-uusapan dyan. Tinitingnan din yung location ng stone, type of stone, yung pasyente, patient status, kung ano yung kondisyon ng patient. Kasi may binabagayan niya. Halimbawa, 1.7 stone pero nasa lower pole tapos masikip yung area ng stone. Kahit mabasag mo yan dyan, 1.7 cm, hindi mo siya mailalabas. Kasi meron kang trap na calyx. So again, merong binabagayan ang tamang stone. Hindi lang, sir, hindi lang basta yung size ang kino-consider. Okay? Pero 1.7 cm on a favorable location, favorable stone type, favorable patient profile, pwede naman. Okay? Pero may binabagayan yung ganyang stone. Ay, yung ganyang treatment sa ganyang size. Diba? Depende. Basically, depende. Pwede, pero depende. Wait, what is this? Okay. Okay. So, lastly, again, summary ng 1 cm kidney stone options are medical dissolution, shockwave, RIRS, and finally, PCNL. This is a minimally invasive way of removing stones. Pero, sa mga options na yan, ito na yung pinaka may invasion. Kasi, tutusok sa tagiliran ng pasyente ng napakaliit na hiwa. Nakikita niyo yung daliri ko? Maliit yung hiwa. Dali, yan. Maliit lang yung hiwa. Tapos, para mapasukan nung sheath na to. Ng sheath na yan. Para madurog ng laser or pneumatic lithotripsy at masuction out yung kidney stone. Okay? Para masuction out yung kidney stone. Sa lahat ng procedure na sinabi ko, ito yung merong highest SFR or stone-free rate. Ibig sabihin sa lahat ng procedure na yan, siya yung pinaka mataas yung chance na maubos yung bato. Kasi meron kang direct vision, direct manipulation ng stones, pwede kang gumamit ng instruments to pick up the stones. Parang pareho lang siya ng RIRS din, pero coming from the outside. Mas flexible lang yung galaw mo dito. And again, depende naman yan sa expertise na available kung saan kayo nagpapatingin. Okay? Ito yung merong highest stone-free rate na procedure. So, bakit mo gagawin yun sa 1 cm stone? Hindi naman siya yung top recommendation for 1 cm stones. Pero, depende nga again sa size, location, paano kung trapped yung calyx, medyo baon sa laman, hindi abot ng retrograde intrarenal surgery, hindi malocate sa shockwave lithotripsy, hindi matunaw ng medical dissolution, then you still have an option of performing PCNL. PCNL means percutaneous nephrolithotomy. Okay? So nakikita nyo yung illustration na to, meron kaming scope na gamit na ganyan. Tapos, masisilip mo yung loob ng kidney mismo with a camera. Kinakapitan namin ng camera head to. Yan. Then, dudurugin namin ng laser or ng lithotriptor. Then, isa-suction out yung stones. Okay? So, ngayon, sana may nanonood na merong na relevant sa inyo to, yun na meron kayong 1 cm kidney stone. What are your options? Para sa mga bagong pasok, ito yung topic natin. You can rewatch this video anyway. Ang options nyo ay medical dissolution, shockwave, RIRS, or PCNL. Lahat ng yan, ng mga procedure na sinabi ko for kidney stones, ay merong binabagayang pasyente, may binabagayang stones, may binabagayang patient profile, comorbidities, status ng pasyente mismo, may binabagayan, okay? What is the best? Kung ano'y nababagay sa'yo. Okay? Hindi ko sasabihin nga kahit isa dyan ang pinakamagaling dahil bawat isa niyan meron silang merits to render you stone free. Okay? Kasi 'di ba? Hindi ko kayo pagdedebatihin na pag sinabi, sa akin gamot lang natunaw na. Bakit ikaw inoperahan ka or shockwave ka? Versus sa akin shockwave ay pini-CNL na wala yung stone. Yan kasi nag-medical dissolution ka lang kaya hindi natanggal yung stone mo. See? May iba-ibang merits yung bawat procedure or bawat method atake into atake sa pagtanggal ng kidney stones. I hope may natutunan kayo sa session natin to ng about kidney stones. Okay, pero sige, sagot tayo ng ito. I have kakasagot ko lang Eril nung sinasabi ko ano pong mas maganda. May binabagayan nga. Parang wala akong not listening ka, Eril. Okay. Ito. Question. Mataas chance ma-dissolve yung stone via medical dissolution? Depende sa type of stone, size ng stone, kung diligent kayo sa pag-inom ng gamot, as in walang palya at araw-araw ninyong minimeasure ang inyong pH level ng urine, then probably there's a better chance of you dissolving that kidney stone. Okay? Uronurse. Kailangan ko ng uronurse. As in. Joke. Pero totoo yan. Salute to subspecialty nurses. Highly skilled people. Thank you for your service. Okay. Relevant question. Doc, magkaiba po ba ang may cyst sa kidney at stone? Yes, magkaiba. Magkaiba. Cyst ay meron kang outpouching na merong laman na fluid. Stone ay stone. Okay. Next. This is a good question. What are the risks of PCNL? Again, bawat procedure may risks din. Very good question. Risks of PCNL. Makita ninyo na tutusok ka sa tagiliran. So, it's invasive, but it's minimally invasive. You have the risk of bleeding. You have the risk of infection. You have the risk of forming an AV malformation kapag tinanggal na yung sheath. Okay? Tapos, around the kidney are the bowels. Okay? In front of the kidney are the bowels. Sometimes, the bowels go around the kidney to the back. So, there's also a risk of bowel injury. Near the kidney, near this place, are the great vessels, aorta, vena cava. So, there's also a risk of puncturing those structures. Okay? Then, you also have the risk of sepsis kapag nagbasag ka ng infectious stones. Okay? So, there are many risks too. Walang perfect na surgery. Kahit anong procedure, lahat ng procedure ay merong benefits, pero meron ding risks. So, it's our obligation to our patients to explain yung risks and benefits ng any procedure. Pero it's also the patient's responsibility to know that for themselves bago kayo magdesisyon kung ano ang gusto ninyong procedure na gagawin sa inyo. It's best to know the risks and benefits ng bawat procedure. Kasi, syempre, kailangan calculated risks yung iti-take natin pareho bilang pasyente at bilang healthcare provider mo. Okay? Very good question, win-win. Winnie Pinpin. Ano pa ba mga relevant questions? Yung mga may mga kidney stones, may pag-asa pa bang malusaw ng gamot? Again, yes. Pero yun nga, may binabagayan. hindi lahat naman na nagkakaroon um, ng dissolution. So, meron ding failure of medication. And failure of medication ng medical dissolution is also another indication for more invasive way of removing the stone or surgical like PCNL, RIRS, shockwave kung hindi uubra ang medical dissolution. Okay? Tingin pa tayo ng mga relevant okay. Ano pa tayo? Ito. Syempre relevant yung costs ng bawat procedure. Medications, depende kung gaano katagal kayong magagamutan. So, added costs kung mas matagal yung gamutan ninyo. Okay? Shockwave, per session yung magiging cost ninyo depending on how many sessions kayong gagawin. Because, sabi ko nga, hindi lahat pareho ng stone-free rate. Shockwave may require one session or multiple sessions depende sa size, location, composition, and configuration ng stone. Okay? Between RIRS and PCNL, depende sa institution na paggagawa ninyo, both will use specialized instruments na pwede mag-add ng costs dun sa inyong procedure. Okay? So, it's RIRS and PCNL on one end of the spectrum, shockwave and medical dissolution on the lower end of the spectrum in terms of cost. Okay? Okay. So, ano to? No. Oh my God. Hindi totoo yan. You'll be at risk of having more kidney stones kapag nagtitake kayo ng carbonated drinks with high sugar content. Okay. Potassium citrate, MAPD sa sikmura, depende sa patient. Iba-iba yung side effect, pero yun nga, again, kung meron kayong side effect na hindi ka nais-nais, follow up with your doctors and maybe pwedeng mapalitan or ma-adjust yung mga medications ninyo. Twice na napisan stone former. I hope you're better now, sir. Okay. Thank you for your questions and maraming salamat sa panonood ninyo. I hope naliwanagan kayo dun sa topic natin na to, 1 cm kidney stone. What are your options? Next, we'll, sa ibang mga video siguro natin in the future, we'll discuss other sizes ng kidney stone. Actually, sabihin ko na sa inyo na in the future, even if I talk about larger stones like 3 cm, 4 cm stones, almost the same ang options. Lahat yan ng options na to, ganun pa rin. Pero magkakaiba lang ng insights per procedure. Kung magkakaiba sila ng stone-free rate, depende sa ganitong size. At magkakaiba rin ng indication for this type of procedure. Okay? So, I hope naliwanagan kayo. Pero we'll discuss then yung other sizes in the future videos. But for now, I want to thank you for watching, listening, and asking questions dito sa ating live videos. Okay? If you have more questions, type nyo lang dyan, mababasa ko naman yan. Or if you have specific questions, specific urological inquiries, you can message me here on this platform. This is live on Facebook and YouTube. Sa YouTube, comments lang ata walang message. Pero if you want more personalized questions, lalo na sa mga ayaw nagta-type sa comments, you can message me directly on Facebook or email me. Ayan, nandito ating email. Ayan. Nandito yung email ko. Okay? Maraming salamat po sa panonood. Ako po si Doc Drew, Urologist. Thanks for watching. Stone free! Yun pala yung tag.